All right, let's break down what you need to know about pulmonary embolism with the new 2026 guidelines.
So what exactly happens when a blood clot from your leg makes its way to your lungs?
It's called a pulmonary embolism, or PE, basically a dangerous blockage in your lungs' arteries.
So what are the first clues? How does your body tell you something's wrong?
Shortness of breath is super common, but fainting, that could signal a really big, dangerous clot.
And something's really up your risk, like recent surgery, being stuck in bed, or even pregnancy.
Okay, so how do doctors figure this out? There's a really clear three-step approach they take.
First, they score the probability. Then, a simple blood test. Finally, they use imaging to confirm.
And when it comes to imaging, the gold standard, the absolute best test is a CTPA scan.
Okay, so once the PE is diagnosed, the next big question is, how bad is it?
And this is a big deal. The 2026 guidelines introduce a new 5-category grading system.
It goes from Category A, which is found by accident, all the way to E, a massive PE.
The really cool part? This new system matches the treatment directly to the risk category.
For most people, it's blood thinners. But for a massive PE, you need emergency clot-busting drugs.
And the go-to blood thinners these days are DOACs. They're just easier and often safer.
But for those Category E patients, the goal is simple. Get that clot out immediately.
That means using powerful clot-busting medicine like alteplase to restore blood flow fast.
All right, so what happens after the emergency is over? Let's talk about the road to recovery.
Typically, if a temporary risk factor caused the PE, you're on blood thinners for about 3 months.
And follow-up is absolutely key. You'll have check-ins to monitor progress and prevent future issues.
Okay, let's wrap this up. What are the absolute key takeaways from all this?
Remember, CTPA is the best test, DOACs are the go-to drugs, and you must risk stratify.
Which leaves us with a big question. How can we get better at stopping these clots from ever forming?